Check the child for responsiveness by tapping on the shoulder and shout, "Are you okay?"
Are you okay?
If no response, call 911. Watch the child's chest for normal movement. This should take no more than 10 seconds. Sometimes you may be able to see chest movement or breathing called agonal breathing. This is not a typical breathing pattern. The person will be unresponsive and will still need CPR. Move the child to a firm, flat surface. Put your phone on speaker mode so the 911 operator can help you count compressions. Draw a line from nipple to nipple. Directly below this line, position the heel of one hand on the center of the chest. Place the other hand on top and lock your elbows. Lean over the child and compress the chest about 2 inches deep. If the 911 operator is on speaker mode, then they will be able to guide you to compress at the right rate. The rate of compression can vary between 100 beats per minute and 120 beats per minute. The sound you are hearing now is 100 beats per minute. You do not want to go any slower than this. The sound you are hearing now is 120 beats per minute. You do not want to go any faster than this. Some songs that may help you remember this rate are Baby Shark, Another One Bites the Dust, and Staying Alive. Connect the ambu bag to the trach. If the child is on a ventilator, disconnect the ventilator and apply the ambu bag. Give 2 breaths. Compress the bag just enough that you can see the chest rise. It should take a full second to compress the ambu bag. Continue giving 30 compressions and 2 breaths until you see signs of life or an emergency response team arrives. If there are 2 rescuers able to perform CPR, then designate one to give compressions and the other to give breaths. The rescuer doing compressions will continue doing compressions the same rate, but does not pause to allow for breaths. The person giving breaths will provide 1 breath every 5 to 6 seconds. Try counting as 1 1,000, 2 1,000, 3 1,000 to allow enough time to pass. If you cannot see chest rise when bagging your child, perform suctioning. If you cannot pass the suction catheter through the trach, then perform a trach change. If you need to remove a trach that is not cuffed, place a roll under the child's neck, release the ties. Insert a new trach. The trach will be easier to place if you have time to lubricate the tube. As soon as the trach is in, remove the obturator. If the trach is a cuffed trach, remove the water from the pilot balloon prior to taking out the original trach. If replacing the trach is not effective, remove the trach and cover the stoma with gauze and/or your hand. Then give breaths mouth to mouth or with the bag mask. To provide mouth to mouth, pinch the nose shut and tilt the head back to open the airway. Place your mouth over the child's mouth and breathe in. You should see chest rise if you have tilted the head and do not have any leaks. If using the bag mask, place the narrow point of the mask across the bridge of the nose. Use a C shape with your thumb and index finger to create a seal between the face and the mask. With your remaining fingers, tilt the head to open the airway. What do I do if my child does not have an upper airway? If your child does not have an opening in their upper airway that reaches their lungs, then place the ambu bag and bag mask over the stoma. Ensure the seal around the bag mask is tight enough that air cannot leak out. You may provide breaths using the same methods mentioned previously using the bag mask over the tracheostoma. What do I do if the trach won't go in? Reposition and try again. If the child is responsive, distracting the child is helpful. If you have further questions about CPR with the trach, reach out to your social worker to get in touch with an educator. You can also find resources at the American Heart Association's website and the American Red Cross website.